Hi to everyone. I am Dr. Rana Pratap Maurya from Department of Orthodontics and Dentofacial Orthopedics, School of Dental Sciences, Babu Banarsidass University, Lucknow. Today I will discuss on growth and development of craniofacial incision, embryology part. So a clear understanding of craniofacial embryology is important as it enables one to recognize normal variation in facial structures and also helps to recognize congenital deformities that occurs as a result of abnormal facial development. So embryology can be said to be complex and well orchestrated morphological events that bring about the anatomic changes during growth. So prenatal growth phase or prenatal life is divided into three periods. First is period of ovum, second period of embryo, third is period of fetus. So period of ovum, it starts from the fertilization to 14 days of prenatal life, and period of embryo from 14 day to 56 day of prenatal life, and period of fetus from 56 day until birth or 227 day of prenatal life. So the period of ovum or pre-embryonic period. So this period starts soon after fertilization when fertilizes ovum undergoes mitosis. And it lasts from conception to 14 days or 2 weeks of prenatal life. In this stage, the cleavage of ovum from single cell to multicellular stage till blastocyst formation occurs, and these blastocysts are attached to the ovum intrauterine bond. So these are the various events in period of ovum. First fertilization, then morula formation, then blastocyst formation, and then implantation of blastocyst to the uterine bond. These are a summary of period of ovum. Here this is ovary, this is ovary follicle, maturation follicle, and this is ovulation and formation of corpus luteum. This ovum, it travels in the fallopian tube, and fertilization occurs at the 1/3 to 2/3 junction of fallopian tube. And here the pronucleus of male and female, that is ova and sperm, they unite and form the zygote. These zygote travels to the fallopian tube and implanted to the body of fetus. First, there occurs various stages from zygote to the implantation. That is cleavage of zygote, it forms the 2 cell to 4 cell to 8 cells, and then morula. And morula, it is converted to the blastocyst, and these blastocysts, they are implanted in the uterine wall. So first fertilization, in fertilization, male and female gametes used to form the zygote, and then formation of morula. Once the zygote reaches to 2 cell state, it undergoes a series of mitotic cell division to form a 16 cell stage, which is called as morula. And then morula is converted into the blastocysts by cleavage of cells. So morula enters the uterine cavity fluid and begin to penetrate through the zona pellucida into intercellular space of the inner cell mass, and a single cavity, here single cavity, which is called as blastocyst, is formed. And the outer cell layer is called as the trophoblast, and where inner cell, it is called as the embryoblast. This embryoblast, it gives rise to embryo. This is implantations. Implantation means the trophoblast, it attached to the sticky endometrial surface on the posterior wall of the body of fetus. Here this is trophoblast. Trophoblast cells, this is blastocyst cavity and inner cell mass. And this is inside wall of the uterus. So here the blastocysts, they are implanted to the uterine. Then formation of bilamellar disc formation. First, the trophoblast, this trophoblast differentiate into the inner and outer layer. The outer layer is called as syncytioblast. This is purple color. The syncytioblast, these are uh, the the cells are not divided and they are multicellular, multinuclear cells. So outer is syncytioblast and inner is cytotrophoblast. This layer is called as cytotrophoblast and outer is syncytioblast. And also the embryoblast differentiate into the hypoblast and epiblast layer. And these two layers, they are called as bilaminar germ disc. So at the same time, the small cavity appears within the epiblast. This epiblast, this is small cavity. And it enlarges and forms the amniotic cavity. Then period of embryo or embryonic period. It extends from the 15-day to 56-day of intrauterine life. And germ layers are formed during this period. And major part of development of facial and cranial region occurs in this embryonic period or period of embryo. Next is gastrulation. In gastrulation, the epiblast cell, it migrates through the primitive strip and definitive or embryonic endoderm cells, they displace the hypoblast and mesoderm is split between the endoderm and ectoderm. These are the various stages of gastrulation. This is blastocysts, formation blastula, and archenteron. This is early, and then formation of early gastrula, where the ectoderm layer, endoderm layer, and blastopore occurs. And in late gastrula stage, all the three layers are formed. That is ectoderm, endoderm, and mesoderm. So this is the process of gastrulation. This is the primitive sticks, primitive nodes, primitive sticks. This is the epiblast layer. From the epiblast layer, the epiblast cells migrate and they form the mesoderms. These are the hypoblast layer and migrates and form the mesoderm layer. So the formation of three germ layer. The cells of the epiblast, here the cells of epiblast cells, it migrates toward the primitive strict region. The layer of epiblast migrate toward the primitive strict layer, which is called as invagination. Once the cells have invaginated, some displaces the hypoblast. This is hypoblast cells. So these cells, it displaces the hypoblast and creating an embryonic endoderm. These are the embryonic endoderm. And other comes to lie between the epiblast layer and newly created endoderm layer. This is an endoderm layer to form the mesoderm. This. From here, epiblast cell layers, some cells migrate, form the endoderm and mesoderm layers. And remaining cells, it becomes of epiblast it forms the ectoderm. So 3 germ layers are formed. Ectoderm from remnants of epiblast layer, and the cells which migrate from epiblast, they form the endoderm and mesoderm. These are cells. The embryonic ectoderm cells from epiblast, migrating mesenchymal cells, embryonic endoderms, and mesoblast are mesoderm cells. So the ectoderm cells, it gives rise to nervous system, epidermis and its appendages like hair, nail, sebaceous and sweet and epithelial lining of oral cavity, nasal cavity and sinuses, and a part of intraoral gland. And also ectoderm also gives out to enamel of that. Whereas endoderms, it gives the epithelial lining of gastrointestinal tract and all associated organs. Whereas mesoderm, it gives rise to muscles and all the structures derived from the connective tissue, that is bone, cartilage, blood, dentin, pulp, cementum, and the periodontal ligament. Then notochord formation. So notochord is a flexible rod-shaped body found in the embryo of all chordates and derived from mesoderm. So notochord is the characteristics of the chordates. It serves as a basis for axial skeleton. It includes overlying ectoderm to differentiate to neuroectoderm to form a neural plate. Here, this is an embryo. This is a magnification of this view. In this, the mesenchymal cells migrate cranially from the primitive period towards the precaudal plate and form a rod-like notochord process. This is a notochord process. This red color showing the notochord process. So notochord process, it becomes canalized. There is formation of a canal forming a hollow tube, the notochordal canal. It is called a notochordal canal, and it is communicating with the primitive pit. This is primitive pit. So there is a communication between the notochordal canal and the primitive pit. The floor of the tube and underlying endoderm. This is the endoderm. Underlying, this is endoderm. So floor of the tube. This is floor of the tube and underlying endoderm. It breaks and forming a notochordal plate. They form a notochordal plate. This is a notochordal plate. So this notochordal plate becomes continuous with the endodermal layer. This is endodermal layer and this is a notochordal. So this becomes continuous to each other. Then the notochordal plate, here notochordal plate fold to form a notochord. These notochordal plates which are attached to the endoderm, they fold to form the notochord, which later gets separated from the endoderm. Here, this notochord is separated from the endoderm. And neural plates invaginate to form the neural groove. Here, this is a neural groove and neural force. This is neural force and the neural groove. Then neuralizations. So neuralization is a process whereby the neural plates, these neural plates form the neural tubes. These plates becomes a tube-like structure. Here the neuroectodermal tissue differentiate from the ectoderm and thicken into the neural plates. This is neural plate. And neural plate borders separate ectoderm So this neural plate border, it separates ectoderm from the neural plate. This is a neural plate border on both sides. So this neural plate border, it separates neural plate from the ectoderm. So neural plates, it bends dorsally. Here it bends dorsally with two ends eventually joining neural plates border. These neural plates border, they join to each other, which are now referred to as the neural plates. This border from left and right side neural plate borders, they join to each other and form the neural crest. This is a neural crest. So closure of neural tube, this neural tube, closure of neural tube, this connects the neural crest, they are green color neural crest, from the epidermis. And neural clades self-differentiate to form the most of the peripheral nervous system. Now the notochord, it degenerates and only persists as nucleus pulposus of the intervertebral disc. And other mesoderm, they differentiate into the somites. These are the somites. And also the precursors of the axial skeleton and skeletal muscle. So derivatives in head and neck region from the neural crest cells. First, the skeletal component, brachial arch cartilage, bone of maxilla, mandible, palate, face, and cranial wall. Chondrocranial cartilage and otic capsule and their endochondral replacement. And neural components, the sensory ganglia of cranial nerves, 5th, 7th, 9th, and 10th. Non-vascular components of parasympathetic ganglia, swan and supporting cranial nerves. Secretory components, odontoblast, pulpal cells, chromatin cells, parafollicle cells, calcitonin producing cells. And connective tissues, cranial vascular tissue, dermal smooth muscle, connective tissue of cranial and lingual muscles, adenohypophysis, salivary, thyroid glands, parathyroid glands, and thymus, and melanocytes and melanophores, dermis and adipose tissue of the face, jaw, and knees. So these are neural crest cells derivatives in head and neck region. Next, pharyngeal arches. The most distinctive feature in the development of the head and neck is the presence of pharyngeal arches, which is also called as brachial arches, which contribute the characteristic of external appearance of embryo. So after the formation of head and head fold, the developing brain and pericardium, these are the two bulging. They form the two prominent bulging in the ventral aspect of the embryo. And these pharyngeal arches form in between the stomodium and the pericardial bulge. So this stomodium is the depression present between the pericardium and developing brain. So around the 4th week of intrauterine life, a series of mesodermal thickening are seen in the wall of cranial most part of the forehead. This is called as the pharyngeal arch. This is the bulging produced by the developing brain, and this is a bulging of the pericardium. So this is stomodium which is present between these two prominent bulges, pericardium, a pericardial bulge, and developing brain bulge. This is stomodium. This is the opening of foregut. And the pharyngeal arches, it develops between stomodium and pericardium bulb. Here, this is pharyngeal arches between the stomodium and the pericardium bulb. This is pharyngeal arches. So pharyngeal arches are seen as a 6 cylindrical thickening. 1, 2, 3, 4, 5. It is seen as the 6 cylindrical thickening that stain and pass beneath the floor of the pharynx and approaches their anatomic counterparts of the opposite side. This is cylindrical opening. This is cylindrical shape thickening here. Cylindrical thickening. It approaches and connected to the counterparts on the opposite side. They contribute the formation of face, jaw, ear, and neck. The first pharyngeal arch is called as mandibular arch. This pharyngeal arch is called as mandibular arch. And second pharyngeal arch is called the hyoid arch. And rest arches do not have its specific name. And fifth arch is transient and disappears soon. In between the adjacent pharyngeal arches, this ectoderm, here blue color is ectoderm, and endoderm, this yellow color is endoderm. It extends toward each other. So endodermal extension is called as pharyngeal pouch, this yellow color. While the ectodermal extension is called as ectodermal arch pharyngeal cleft, this blue color. These are the first pharyngeal arch, mandibular arch, second pharyngeal arch, hyoid arch, third, fourth, and fifth. This is pharyngeal cleft or ectodermal cleft is a pharyngeal pouch. So each pharyngeal arch is separated by groove and it contains 4 components. The central part is cartilaginous part, then muscular part, this is muscular part, vascular, contains artery, veins, and neural component. So these are the 4 components of each pharyngeal arch. Then derivatives of pharyngeal pouches. The first pharyngeal pouch, this pharyngeal pouch, it gives a primitive tympanic cavity, auditory tube, and inner surface of eardrum. This is inner surface of eardrum. And second pharyngeal pouch, it gives a palatine tonsils and tonsillar fossa. And third pharyngeal pouch gives the thymus gland. This is thymus gland. And inferior parathyroid gland. And fourth pharyngeal pouch gives out the superior parathyroid glands and thyroid glands. This thyroid glands and superior parathyroid. And fifth pharyngeal pouch gives the ultimopharyngeal body. Next, derivatives of pharyngeal arches. The first mandibular arches is skeletal components, malleus, incus, spine of sphenoid bone, sphenomandibular ligament, Meckel's cartilage, and lingula and its muscular part is muscles of mastication, tensor palati, tympanic palati, mylohyoid, and anterior belly of digastric muscles. Vascular part is maxillary artery, and neural part is mandibular branch of fifth cranial nerve. And second arch, this is called as Havoid arch. It gives the skull component, stapes, stylos process, stylohyoid ligament, lesser cornea, and lower part of body of hyoid. Muscles, muscles of face, platysma muscles, posterior belly of digastric muscles, stylohyoid muscles, and stapedial muscles. And vascular component is arteria stapedius. Nerve is seventh cranial. And third pharyngeal arches gives greater cornu and lower part of body of hyoid bone. Muscular part is stylopharyngeus muscles. Vascular component is internal and common carotid artery. Nerve, glossopharyngeal nerve, that is 9 cranial nerves. Fourth pharyngeal arches gives a skeletal component, thyroid cartilage, muscle, kyphothyroid muscle. Vascular part, aortic arch on the left side and subclavian artery on the right side, and superior laryngeal nerve. Whereas fifth is transient and it disappears, and sixth pharyngeal arch gives rise other cartilage of larynx that is required, arytenoid, corniculate, uniform, and muscular part is other intrinsic muscles of larynx, constrictor muscles of pharynx, muscles of palate, except tensor palate. And vascular component is pulmonary artery, ductus arteriosus on left side, recurrent laryngeal nerve, that is 10th nerve. Thank you.